Hey guys, so basically this video is about the stuff that I'm gonna be taking to the hospital. Yeah. Like I said, surgery is February the 5th. Today is Friday. I'm a week away from it. What kind of today's Friday, January the 30th. And I just got a couple of things that I got, or a couple of things that they told me that I should have for after surgery. They gave me a little packet and stuff to tell me my diet and whatnot. Um, Basically, they already gave my prescription to fill out. My prescription for the pain meds, the nausea, and the meprazole. I hate a meprazole. Well, I hated it. I couldn't stand it. I couldn't take it. I couldn't do anything with it. So I figured out a way of doing it now to be taking omeprazole, and it's basically, oh crap, I just noticed something. Just noticed something big. Basically, I'm trying like, okay, never mind. Sorry about that. Basically, what I do with the omeprazole now, so I can take it, because apparently it's I'm obligated to take it. It reduces the acid levels in your stomach, so I have to take it. I just open the cap up and I take it like it's a shot. And I drink my water with it along. I don't taste anything. I don't have anything. They told me to take it with applesauce to put it in there, but I don't like applesauce like that anyways. It's like, come on. I take protein shakes. I take Jello. I had yogurt and I had ice pops. I want something warm at this point. I don't want to take this with something cold. Like, it doesn't really matter anymore. So I just take it like I said, like it's a shot, and I just have it that way. Whatever. Um, the pain medication that they gave me, I wasn't able to find that in my pharmacies. They say they don't carry it. So I either have to go somewhere else to find that, or basically have to wait the day of surgery. The nurse practitioner told me that they have a pharmacy that in the hospital, and that I can they they told them to specifically to carry that pain med for this specific surgery, so I can either get it that day, but she told me to have it in advance. So we'll see. If I can find it here, great. If not, then I'll have to wait until the day of. So then they gave me a little list of things I should stock my home with the following items, which is broth, chicken, beef, or vegetable, whatever my choice is, sugar-free jello, which I already have, bottle of water, which I don't need, measuring cups, I have cups and spoons, baby spoons at that, sugar-free ice pops, like I said, I already have, sterile gas pads with the slits, 4x4, I couldn't find those exactly, but the only reason why they even mentioned me of getting that one was, I'm sorry, was for me to get that was because of the incisions. In case of my clothes getting stuck on the stitches, or whatever it might get stuck on, they they wanted me to have that to cover it with a gauze pad so it won't bother me. So what I did was bought this. It's a waterproof pad, like a Band-Aid kind of. And it's germ proof, so and it brings 6. So I think we're okay. We'll see with that. Again, that's what it looks like. They also told me to have medical tape, which I don't need because that one's like a sticker. It's like a Band-Aid itself. Um, adult liquid Tylenol. I feel like this thing does not exist, or they do not make this anymore, because I even looked for it in Amazon and I can't find it nowhere. So she said if I could not find adult liquid Tylenol, to get children's Tylenol. And my boyfriend got me the cherry one, but I hate cherry medicine. Anything that has to do with cherry, it just reminds me always of like my childhood nasty ass medicine. So I got the grape flavor. So that was a plus. Um, it says adult Tylenol suppositories. I don't know. They never really touched base on that. That I need to get it, but I guess not. So I'm not getting it. Milk of magnesia to make you go, because you need to regulate yourself. And it says glycerine depositories, no laxative. I don't know if the adult Tylenol and the same. I don't know. What is it? Is it the same thing? Whatever. Apart from what this list said, I got a couple other stuff myself. I got the X-Lax. This brings 30. I couldn't find one that brought less. I bought this at Target. And I don't really want to be gassy. I don't want to be discomfort. Like, I don't want to be like that. I also got my deodorant. It comes in 2-pack. I already used the other one. This is the one to take to the hospital. Of course, my travel size toothbrush and toothpaste. Gotta have that. My little glasses that I barely ever wear, which in case if I want to watch the hospital TV and not watch anything on my laptop, I'm taking my laptop and my phone and the chargers. In case if I can't watch the TV from a far away distance, I'm taking my glasses. Yeah, it's weird, right? My bangs and glasses like really don't mix. I don't really like using glasses for the simple fact like they do this to my ears, kind of stick it out a bit. Yeah. Yeah, baby, yeah. It reminds me, every time I do something like that, it reminds me of my boss. And I bought Tampax. Tampons, Tampac. Well, they're tampons, but they're called Tampax. I was like, what? Why am I saying it wrong? And funny story of me mentioning the tampons. Basically, I don't get my periods. I've been spotting. Last time I spotted was in May when I joined. Was it May or June? No, it was. I think it was June when I basically signed up for the gym, and I thought, I don't know, it's weird because growing up and started gaining weight, I've learned that being obese can irregulate your period. Being active can also do that to your period. Um, Birth control can also do that to you. So in the moment of me, disregard that sentence completely. I have birth control. I have the implant on that goes right here under your skin, and I have that, and I've gotten that. I have almost 2 years with it. In April, I would have 2 years, and basically, I forgot where I was going with this, but basically, I have that, and I have not had my period since then. Like I said, I spotted in May when I joined the gym, and I don't know if it's because I was being active that my body or started reacting so certain way, and I spotted. Like I said, I didn't get my. Well, I actually didn't get my period. I spotted because I actually just spotted for like that one day, and it was gone. And I found it weird. And they say that if you're overweight, it can irregular your period. It can come, it could go, it could like vary. So I found it weird when that happened. And since I'm on this 3-week diet and I lost 7 pounds, I spotted today, which was very weird. This morning I woke up and went to the bathroom, and it's this topic is a little TMI, but I wiped and I saw blood, and I was just like, what? Wait, what is that me? And yes, it was me. Which I found very weird. after I got home from work, I got into work and I still saw like blood. I'm like, okay, maybe it is my period. Maybe I'm not spotting like last time. But I came home from work and I went to use the bathroom again, and it's like completely gone. And like I said, it's like me spotting. And because of this, and it's weird because recently I just basically found out about PCOS, and I didn't really know. I heard about it, but I didn't really know into depth what it is and what it does, and the symptoms of this. So I could have this and not known. I could have had this for a while and not known. So it's funny now that I'm having surgery. Um, and the only reason I touched base with this and got into more depth with this was 2 weeks ago when I started watching My Big Fat Fabulous Life, and she mentioned it, and she was mentioning some of the symptoms, and I said, wow, this is really similar to what I have. um like I said, I don't get my periods because I've been having birth control for like since I was in high school, like the end of high school. And even then, when I stopped birth control, I would have it, but at that point in time, I wasn't this overweight. And so now I kind of went and I want to go to the doctor and get some tests run and see if I have something like this. I went to my primary care doctor on Wednesday, and she told me basically my gynecologist would tell me the results of that, or would run some tests basically. I'm sorry, don't look at this finger. I said don't look at it, and I pointed it out. I don't think if I pointed it out you would notice, but whatever. Back to the topic I was talking about. My primary care doctor said my gynecologist would actually help me more into depth with that. So I am planning to go on the gynecologist day before of surgery, because that's the only day that I'm really available to go. And my mom is gonna go. She's also gotta go and make an appointment with her herself. So we're gonna see what's going on with that, because that kind of concerned me because I have the symptoms where I have a mustache, and you know, you obviously can't see it's not fake, but it's not like also man hair thick or like my eyebrows hair thick, but you can see the peach fuzz kind of. And I don't mean peach fuzz like the peach fuzz that grows down there, because those are thick peach fuzz. But I mean, like, you can see the little peach fuzz that grow. I have it right now, but you just can't see because of the quality of the camera. But as much as I have to pluck my eyebrows, I would have to do my mustache. Also, I have a little patch of hair right here that just started coming in this year. I started getting a little thicker hair here on my chin, and I didn't find the mustache and chin hair a big deal because my grandmother and my mother has that, and my mom is always like, but they're in a point in time and age where they can expect that because their hormones change. And like I said, well, I didn't say, but now I'm gonna mention it, that when I went to my primary care doctor, I had whatchamacallit, a urine a 24-hour urine test, because when she did the checkup on me, she checked on my belly to see if I had any pain. While she was there, she saw that I had like some I had hair on my belly, and it's because I saw the little peach fuzzes growing up. I saw it coming in, and I would shave it. So my mom once told me, once you shave it, it's gonna come in thicker and uglier. And I wish I listened to her and not be as stubborn as I am to this day. But basically, she saw it and she was like, I'm gonna want you to do a 24-hour urine test to see if your hormones are in balance. So she did that. We checked, I got the results and everything was fine, but I'm still concerned because the rest of the symptoms sounds like something I would have. Basically, I lose a lot of hair when it's dirty. It falls out when I'm in the shower. I just, when I'm combing and just straightening out to take out detangling it, I lose a lot of hair. Like within a year, I think I could make a wig, or maybe even less within a year. Um, Besides the chin hair and mustache, like I said, and the little patch that I might have here on the side, I might have like one or two thick hair that would always pop up, and it's on the same place. So I don't know if that has to do anything with it. I have a friend, and she also had the surgery. She actually had a sleeve. I'm getting the bypass, the RNY, and she mentioned to me, and she's like, "Oh, I have this for a while, and I know almost like everything about it. Let me ask you some questions." And she asked me if I have my period, and I basically explained to her what I told you guys. She mentioned about the facial hair if that happens to me, and she said, well, within age, she said with the age or within age, everybody experience some hormone imbalances. So that what happens with your period and also with your facial hair, which that's understandable. She said, but with my age, I shouldn't really be having that problem. So it kind of concerned me. She also asked me a question if my underarms and between my legs or my neck is dark. Between my legs are dark, and so are my underarms. My underarms actually have been dark for a really long time, and I actually wondered or wanting to whiten that area because I find it disgusting in the summertime when I raise my hand or to reach out to get something, and that dark area looks horrible. But I've been told that it could be from the underarm hair, so I didn't really put mind to that. The darkening on the neck, I have very, very little, but I kind of do have it. But it concerns me because I've saw something on the internet where that can mean that you're about to have type 2 diabetes or something like that, or something about diabetes. I don't remember. It's been a while since I read that article. So that was that, and basically I'm kind of concerned about that. I want to run these tests before my surgery because she told me with the surgery it's gonna, if this is what you have, it's gonna help a lot. She said it could go. She said, quote, she said, I'm sorry. Let me see. I can actually look up the message exactly what she said. Why am I wasting my time and making myself look like a fool? Um, she basically mentioned that she said it would go away. Let me see. All right. So I don't want to quote and say that she was wrong or that's what she said exactly. Um, yeah, she said, but you're about to have surgery, so that should go away. So I asked her, I was like, so if I lose all this weight and I said, let's say if I have PCOS and I have the surgery, does it go away? She didn't really know how to answer me that. I don't know if it does go away. She's obviously not a doctor. I would have to talk to my doctor about that. But I'm guessing it does get better. So that's why I want to know before I have surgery if I have this, because I don't want to have surgery and then it won't be clear to see if this is what I have or if it's just something else and other symptoms or something. But yeah, this is basically what it is now. And this is my update. And I forgot to mention some other stuff that I was gonna pack because I mentioned the tampons. Um, Besides all that you saw and the tampons and me rambling about PCOS, I have sweatpants and well, a sweatpants and a sweatshirt, which is gonna be my outfit to go to the hospital with, and to come home with because let's be honest, some people might say that's gross, but let's be honest, you're gonna wear that outfit the trip to the hospital in 2 hours or an hour in the hospital. Then you're gonna be changed into a robe, the hospital gown, and you're gonna be in that hospital gown for like 3 days. So let's be honest. You can use that same pair of clothes, article of clothing, and wear it to go home. So that's exactly what I'm gonna do. I'm gonna have my Uggs to be comfortable, and I'm gonna take a pair of thin sweatpants if I want to wear it in the hospital. I don't want to be showing my legs all the time, and in case if I'm cold, even though I know I would have my hospital blanket, but still, I'm gonna take about five underwears, pairs of underwears, and about 3 pairs of socks. Cause you can never have enough underwear ever in your life. 3 pairs of socks. I guess the one for each day, or maybe 4. I don't like wearing reusing socks cause my feet sweat. Ugh. It's funny I'm thinking like this, thinking out loud. um, but yeah, that's my Adidas flip flops. They're guy flip flops. They just go in, which I love those. Cause I don't want to be walking the floors with my socks. Ugh. And I also need to bring a little. It's like a little container. You see, like one of those little bottles of hand sanitizer, but a bottle like that small with liquid soap because after surgery I can't shower for 24 hours, not even 24 hours, for 48 hours. So that means I can't shower for 48 hours. Being Hispanic, I was brought up that if you can't shower or you're not going to shower, you're gonna wash your vajayjay. And I'm gonna wash my vajayjay when I'm in the hospital. Nobody wants a nasty ass bitch in bed smelling like cuchi frito, which that sounded mad Puerto Rican, even though I'm Dominican. It doesn't really matter where we're from. um, that's that. And a hairbrush. Even though I'm gonna get my hair done the day before, so I won't have to really bother with my hair. Yeah. Oh, did I mention? Yeah, my glasses. I am losing it. I am completely losing it. And probably a cheap perfume that I have laying around. So when I'm gassy and I'm like farting, just and yeah, that's about it. I was gonna say eyeliner for when I leave the hospital, but who has time for that? Alright, see you guys on the flip side. Bye bye.